the question is then, why do we still have these disparities? Because, of course, the NHS was founded in 1948. We've had 50 plus years of public healthcare system. Why has our public healthcare system seemingly failed certain communities, amongst which are ethnic minorities, but we also heard from our previous witness, are women as well?
That's, again, a really complex area, and it could be at a number of levels. First of all, the awareness of that population to the disease, access to that disease. So in my area of diabetes, we still find that ethnic minorities do not get the new therapies that are available that are more likely to be cardioprotective. Now, we don't know the exact reasons, but that is a complex area, whether it's access because of the primary care practitioner that they're accessing, whether it's because they are not keen on taking that. All of that research hasn't been done. And then there may be different pathophysiological mechanisms as well. That's really early in its infancy. And I'll just give you an example. Chest pain, ethnic minorities such as South Asians access ambulance call out much later than white populations when they get a heart attack. Now, we don't know the main reason. This could be cultural reasons, but they could be pathophysiological mechanisms where they're not feeling the pain in the same way as the white population is.
So could I summarize, because we are looking for solutions to present to government, could I summarize it by asking you, would you say then that we do have an infrastructure that should be supportive of narrowing health inequities and health inequalities, but what we need to do now is set our sights on ensuring that the research that is done also takes into account gender, poverty, ethnicity, race, and so on. All of those things.
All 9 characteristics need to be taken into account. And I think the way to look at this, we've learned a lot in a year. A lot of bad things have happened, but I think a lot of good things have happened in terms of where we are now compared to where we would have been. We would have been here talking about ethnic minority disparities if the COVID pandemic hadn't happened. But I think what we now to do is critically look at each touch point of where there are differences with those characteristics that you mentioned. So from a patient getting the symptoms or being screened, then being referred, how long they have to wait to be seen, are there disparities there? Once they've been seen, how long is the follow-up? Are they being followed up as appropriately as the other ethnic minority groups? If they're waiting for a surgery, do you have to wait longer if you have any of those characteristics? And once you discharge, is your follow-up the same? I think at each touch point, we need to look at this and see where biggest problems are and act on those.